Welcome to Nutritional Therapies for Mental Health. Our current module will take you step by step through the practice of nutritional therapies with a focus on supplements, the use of vitamins, minerals, special nutrients, glandulars for both the prevention and treatment of mental distress. One of the major principles I'd like you to consider as we proceed through this module is the idea that diet is essential, but it's not sufficient. For many of our clients, we need to do optimal supplementation and sometimes mega supplementation to correct long-standing deficiencies or to provide alternatives to substances that have created imbalances in their brain-body function. And that's what I'd like to explore with you in this module. Now, I want you to go back and think about what we explored in the module on ethics, because what we're going to explore today will give you some opportunities to consider the role that you will play. I would like to share with you the state of the art of what is known about nutritional supplementation for mental health, as well as the intersection with physical health as well. And some of you may take this fully and develop a full practice depending upon both your scope of practice, your competency, and the state in which you live. Remember that nutritional supplementation is governed by each state, not by a federal law, but by state laws. And so as we're going through this module, I'm going to be teaching you what is known out there in the latest science and practical application, and then how to apply it with your clients. Now, it's going to be up to you to define the role you play. Are you going to advise your client of what is known and then refer them to a nutritional therapist or a dietitian to work with? Or are you going to be able to develop a program and a protocol for the client yourself? And only you will be able to make that decision. So I want to remind you to review that ethics module if you have any questions. But my approach with this module is to teach you everything or close to everything that's known out there that's at least a first step in starting treatment. And it really gives you a good foundation for next steps in your own studies. So what are our goals in the practice of nutritional therapies, and in particular nutritional supplementation? We're going to address the cause of mental dis-ease at a biological level and a functional level. We also want to correct imbalances. These may be imbalances that have been at place since birth, since prenatal periods. For example, lack of essential fatty acids in the diet. They may have developed as a result of use of certain pharmaceuticals or exposure to stress. There can be any number of things that affect imbalances and nutritional deficiencies. Our goals are to reduce inflammatory process in the body, to reduce oxidative stress. You recall the rusting that we go through as a result of oxygenation or oxidation of cell tissues, of free radical damage. We're certainly going to want to manage the stress response. We not only want to address cause, but we can use nutritional supplementation to address the symptoms as well. And I want to share with you some wonderful protocols to reduce anxiety, to improve mood as well. We want to enhance mitochondrial function, the little engines in our cells that we know need to be optimized in order to optimize mental and physical well-being. We're going to use nutritional supplements to balance our circadian rhythm, one of our core principles of achieving mental wellness. We can use nutritional supplementation, particularly the fats, to enhance neuronal communication in the brain. And we can also use supplementation to address epigenetics. Epigenetics is the new science since the decoding of the genome that understands how food and nutrients can turn on or turn off our genes. Our genetic heritage does not sentence us to any particular outcome in terms of our mental or physical well-being. So we can use foods as well as nutritional supplements to dampen genetic responses or enhance them. And we'll touch on that during this module. During the goals that we set with our clients, we've set understanding what their biochemical individuality is, and this will also determine the specific nutrients we may choose for a client. We're going to enhance digestion. That's perhaps one of the first steps we can take that's within scope of practice. That's very easy to do, and we've talked about that in previous modules, but just by adding enzymes to the diet, they're not contraindicated for any reason, and they can help the digestion of food and improve the utilization of nutrients. We want to have a goal of delivering easily assimilated nutrients as well. We want to manage, reduce, or eliminate symptoms that are bothersome. We may decide to provide alternatives or synergists to current pharmaceuticals, and this will be a separate module I will address following this one. And we want to also importantly have a goal to identify adherence strategies. This includes dosing and delivery. And this means going back to the assessment and understanding what's going to work for you. How are you going to ingest the nutrients and the fats that are going to be good for you? What's going to work for you and your particular life and your family? The essentials of nutritional supplement dosing. Treat the individual, not the disease and not the symptom. Understand what the individual needs. Many different kinds of people can experience depression. Depression is not just one symptom. So understand the individual and understand what their symptoms are and what their dosing needs may be. I believe in spreading nutritional supplementation across broad areas that include vitamins, minerals, amino acids, special nutrients, and glandulars. Tailor the protocol to the client's needs and plan for incremental change. If a client comes to me taking 5 or 6 vitamins and minerals and botanicals, they may be interested in adding some more in or having their protocol fine-tuned. Maybe they've learned off the internet and now they're ready to really understand what they need. But if I've got a client who's never taken anything and may say, I don't believe in it, or I have trouble swallowing, then I'm not going to suggest a protocol with 10 different vitamins, minerals, and glandulars. So understanding the needs and the mindset of our client is going to enhance their adherence. I like to start with lower doses and increase them slowly. Just like in pharmaceutical use, people can have a very good response to subclinical doses. Plus, with many people who are sensitive, they can have a reaction to certain nutrients or certain supplements. And so starting one at a time at a low dose. This is especially true with amino acids, but not limited to the amino acids. Start low and you can always add in. The principle of adjusting for children and adolescents generally is that you adjust by age and body weight. And then again, think of your core foundation first. Your broad spectrum vitamins, a broad spectrum good quality B vitamin and mineral, your fats, your amino acids, your glandulars, and then think about increasing your dosing one at a time once you've seen that the individual has adjusted well to your recommendations. Always consider the quality. I would rather that you have one vitamin mineral that's a very high quality than 4 that are poor quality. And generally these are pharmaceutical grade. I will provide you at the end here with some resources that you can develop an account with a number of vendors as a licensed clinician so that you can get high quality, wholesale, and you can refer your clients to these products and know that the quality that you're getting is pharmaceutical grade. This means if it's fish oil, they have distilled fish oil, for example, to distill out heavy metals. If they are vitamins, they do not have color additives or preservatives added. And so it's very important to maintain very high quality. The other principle is that all supplements have cofactors. Certain vitamins and minerals work together to synergize each other. We know, for example, that vitamin B, and particularly B6, synergizes the SSRI because B6 supports neurotransmitter function. And so as you're studying the use of vitamins and minerals, know that they work together. Just like what we do clinically is all designed to have a synergistic effect with our clients' well-being. A general principle of dosing and development of protocols is to review and adjust those protocols every 3 to 6 months. Just like we become sensitized or inured to the effects of an exercise program, we can become sensitive to certain supplements that we're taking. I recommend that for any protocol that you take a supplement for 3 weeks, 21 to 25 days, and you take a break for 5 to 7 days. Now there may be certain supplements, for example an anxiolytic, that you'll continue to take during that time. But by and large, you build tissue, you support organs during these 21 to 25 days, and then you give the body a break and allow the elimination of waste. And when we explore detoxification, I will give you some methods during which those 5 days you will employ these detoxification strategies. So as a general rule, 21 to 25 days on, and give yourself 5 to 7 days off. And this will also enhance adherence, where it can be difficult and challenging to adhere to a protocol. The other principle to consider is to start with where you're going to get your first and fastest response. I want to engage hope, I want to engage adherence, and I want to choose, let's say, a B vitamin or some fish oil, maybe some stabilum, some de-stress, something that's going to give some immediate response to increase energy, to increase focus, to reduce anxiety. Certain nutrients will work within a matter of hours and days. Some you need to build up over time before you notice the results. And we'll be exploring some of these principles, but keep that in mind as a major principle. Try to choose something where you respond to the client's needs so that they get those desired results quickly. What about contraindications and side effects? As we go through each vitamin, mineral, and glandular, I'll share with you some of these specifics, but let's talk about general principles of how nutritional supplementation works. It can slow or increase metabolism. It can slow or increase the excretion of certain medications. And this is why it's going to be very important to run a drug nutrient herbal database analysis of the drugs and the nutrients that you're going to be recommending. Nutrients can potentiate or synergize action of certain medications. For example, if you have a client with diabetes, there are many hypoglycemic nutrients like chromium, which reduce cravings for carbohydrates, increase sensitivity for uptake of glucose, but they can lower glucose. They can have a hypoglycemic reaction, and if you have a client who's on a diabetic medication that's already doing that, it can potentiate that as well. And nutrients can also synergize and potentiate reactions, for example, vitamin K, which reduces blood clotting. And so if someone's already on a blood thinner, it can thin the blood even further. And so it's very important to always run a drug nutrient herbal screening. And this is what I call keeping your clients safe with supplements and herbs. And I've given you a link here to a wonderful online database for professionals. Let's just take a few examples. 5-HTP is a amino acid, which is a natural SSRI. And so if someone begins taking this along with an SSRI and takes too much of it, they can be vulnerable to serotonin poisoning. Now, the obverse is true as well. It can be a wonderful amino acid to reduce the use of pharmaceutical SSRIs and to even replace them. And so this is the kind of thing we want to warn our clients about. Melatonin is another example. As I mentioned earlier, sometimes people take way too much melatonin. And so it's important to take, during the assessment, their drug nutrient herbal intake and then to run it through the database. People may use kava. Kava is a wonderful botanical that we'll explore in our module on herbal medicine, which targets the benzodiazepine receptors. But if I've got a client who's using benzodiazepines and I'm trying to help them eliminate them, I may use kava, but how is it going to be dosed while they're also using the benzodiazepines so they don't get too much? Same thing with St. John's wort, a botanical, which is a natural SSRI. What if the client says, I'm on an SSRI, I want to use 5-HTP, and I want to try St. John's wort? So this is where our drug-nutrient interaction and knowledge and choice of the multiple options we have working with our clients comes into play. Now, it may feel overwhelming to consider all this, but it really is just going to take study and practice and observation, and certainly a reading of the scientific literature. So we're going to do a comprehensive drug nutrient herb analysis. We'll look at nutrient deficits as a result of medications, and we will look at the benefits or the detractions of mixing nutrients, drugs, and herbs. I've given you also here drug, nutrient, and herb interactions in the form of not just an online database, but books. For example, Herb, Nutrient, and Drug Interactions by Mitchell Stargrove, a naturopathic physician. There's also an online database. The PDR has this online as well, and there are multiple online databases that continue to be updated. I've also noticed that some databases tend to be too cautious, and so you'll have to put this all into the mix and keep referring both to the references I provide you, my textbook, Nutrition Essentials for Mental Health, and also updating the literature as you proceed in your work. So now let's look at the best vitamins, minerals, amino acids, fats, glandulars, and special nutrients for mental health. I'm going to walk you through each one of them and how and when to apply them, and then at the end, how they all look together in a protocol. Consider our core nutrients for mental health, where you can begin with everyone. The B vitamins and minerals, free amino acids. This is a product where you get all of the amino acids. And you recall during our culinary medicine module, I spoke about the role and importance of protein in mental health and for the brain, because it's the amino acids that are the substrate that contribute to neurotransmitters and our mood. So rather than giving one amino acid, I like to begin with all of the amino acids in one capsule or one powdered formulation. Fats, I think we are all familiar with the role of fish oil, of coconut oil, of raw butter, of good quality dietary fats, but oftentimes our clients need supplemental capsules or liquids. And this is the stuff of our smoothies or taking a few capsules every day. And I'll discuss this more in a few minutes. Probiotics should be part of everybody's dietary protocol in the form of fermented foods, but they can be supplemented with powdered or capsule or even pill form. And the thing to keep in mind about probiotics is you can get heat stabilized probiotics, or you can get refrigerated probiotics as well. And then finally, glandulars. I find in my travels around the world and teaching, many people are not as quite familiar with the role of glandulars, and I want to introduce these to you and share with you about their potential. One of the big questions we ask is, how am I going to ingest these nutrients? And as you know, I'm a big fan of smoothies. I'm a fan of getting these nutrients into us in as enjoyable a way so it does not become onerous, so we don't get into a battle with the kids or with ourselves about swallowing pills. So having lots of smoothie recipes on hand allows us to make delicious berry-rich smoothie drinks, green tea rich, chocolate rich, coconut fat rich, but also allows us to put liquid fish oil or gamma-linoleic acid from borage oil. It allows us to put powdered nutrients and make this very palatable. It's good for elders, it's good for kids, it's good for all of us. It's a great way to introduce people to taking nutrients that are good for themselves and yet are not going to cause a problem in a busy schedule. Essential vitamins for mental health. Think about vitamins as two major broad types. One is water-soluble and one is fat-soluble. The water-soluble vitamins are soluble in water, but the fat-soluble require a good quality fat diet and are ideally taken with a fat-rich meal. This is one of the dangers of a low-fat diet, that a low-fat diet often leads to low fat-soluble nutrients. And what are the fat-soluble nutrients? Well, vitamin D is one of the most important to begin with. If you're going to begin with one vitamin for your client and one test, I would begin by testing for vitamin D deficiency and dosing vitamin D. I like vitamin D emulsion because you can get it in liquid form. You can get 2,000, 4,000, 5,000 units of it in just a drop or two. Makes it easy to take. We know that vitamin D deficiency is associated with chronic depression and pain and immune problems. There's a very high percentage. Some statistics suggest 97% of the US population is vitamin D deficient, and more so people in the northern climes because of exposure to sun. being less throughout the year. However, we also know that as we age, we do not absorb vitamin D through the skin as efficiently. And so these are two considerations to keep in mind. Everybody should have an annual vitamin D serum test. And Dr. Hollick at the Division of Endocrinology suggests that to address a vitamin D deficiency, you can do an oral dose of 50,000 units of vitamin D once a week for 8 weeks. And then long-term prevention is 5,000 units once or twice, 50,000 units once or twice a month. Or you can take, for example, 5,000 units a day as well. And so your vitamin D levels will be revealed that you should have about a 50 to 80 nanograms per nanoliter on your test. The next vitamin that I think is essential to begin with is a good B complex. It supports relaxation, cognition, energy, supports neurological function, and as I mentioned, they provide cofactors in neurotransmitter development. Let's talk a little bit about the B vitamins and genetics. And you may have heard about the MTHF genetic marker. I mentioned the complex B vitamins are the first choice for core neurological support. They support particularly neurotransmitter function, they support blood glucose uptake. However, we know from the decoding of the genome that upwards of 40% of the population may have a genetic variation called the MTHFR variation, which is an enzyme that's needed to convert the B vitamin folate. And if it doesn't, this makes people vulnerable to depression, as well as high homocysteine levels leading to heart disease. And so with this understanding of the challenges of the conversion of the folates, a new type of vitamin, a B vitamin, has been developed called L-methylfolate, which takes the conversion factor out and provides a biologically active form of B9 or folate. And so this is not a very expensive genetics test to run. And so if you've got a client who's tried B vitamins, or another way to think about it, who has depression and high homocysteine levels, it's very possible they may have this genetic variation called a SNP. And they can get a test for this, and they'll benefit from L-methylfolate. Niacin is another water-soluble vitamin B3, it's also called. Niacin and niacinamide is used for depression, anxiety, and alcohol addiction. Now, niacin targets the GABA receptors, so it can be very relaxing. It's used for mood stabilization, it's a sedative, and it should be a core treatment. Additional niacin can be added for the treatment of anxiety, depression, insomnia. It's also used for cognitive decline, and it also helps alcohol withdrawal. Dr. Hoffer, who was one of the original researchers in the field of orthomolecular medicine, the use of vitamins and nutrients for treatment of the brain, specialized in both the treatment of schizophrenia, psychotic disorder, and alcohol addiction, suggested that niacin at high doses was the mainstay of his treatment for withdrawal from alcohol. And I'll give you that protocol a little bit later. He also used large doses of niacin for the treatment of schizophrenia. So, for example, Dr. Lake, integrative medicine psychiatrist, suggests 15 grams of L-methylfolate or 500 milligrams of thiamine 3 times a day, and suggest from 3 to 8 grams, that's 3,000 to 8,000 grams of niacinamide to improve outcomes with the use of the antipsychotics. And we have such a dearth and such a challenge of the use of drug treatment in psychosis. I have found it's very worthwhile adding in intense nutrient support. And the real challenge is in finding and getting adherence in caregivers to then get these nutrients in during the day. It's not so much that these nutrients don't help, it's how can we get them in? How can we help the client take these nutrients on a regular basis? A special nutrient called picamilon is a combination of niacin and GABA. It was designed to cross the blood-brain barrier. It increases blood flow into the brain. It's also used for depression, alcoholism, migraines, and traumatic brain injury. Now, some of the contraindications can be at very high doses. It can contribute to nausea and vomiting. So again, the principle of start low and build up tolerance. Vitamin B6 is something we hear a lot about because it supports serotonin synthesis in the brain, and it's being added to pharmaceutical SSRIs. It's a very common deficiency, and a deficiency can contribute to insomnia, hypertension, PMS, and irritability. It's commonly used for depression and anxiety. And the preferred form of vitamin B6 is called pyridoxal 5-phosphate. That's the active coenzyme form of B6. So look for that in your resources. Another water-soluble vitamin called vitamin B8, inositol, has been used. It's effective for depression, panic attacks, agoraphobia, obsessive compulsive disorder, bulimia nervosa, and binge eating. It's used very commonly for OCD. And so again, you can look at your B vitamins, your B complex, your amino-free acids, so you get your core support, and then you can choose a particular vitamin, for example, inositol, to dose upwards, let's say in OCD. Gelber's research found it more effective than fluvoxamine in the reduction of OCD symptoms. And significant work's been carried out by inositol. Dr. James Greenblatt's done some very important work on the use of inositol for the treatment of mental illness. We come again to folate, vitamin B9. It's found in plant foods. It's very high in our legumes and beans, for example. Many people suggest supplementing with folic acid, but that's a synthetic form. And so avoid folic acid supplementation and go for the biological folate. And this means avoid these folic acid supplemented foods that you see. You'll see folic acid enriched. Eschew all of those. Go for your natural biologically active folate. We know that there's a strong correlation between a deficiency in folate and depression. The L-methylfolate that I mentioned earlier has few to no side effects. If people have a lot of systemic inflammation, they may experience some irritability and insomnia. B vitamins are energizing, so don't take them late at night. Take them throughout early part of the day, midday, later afternoon. They give you lots of energy, and that's one of the first signs that a client can tell that they're working for them. And they may see that their urine looks extra yellow because they're excreting. It's water soluble, what they may not be using. Again, start at a low dose, and you can always increase from there. One of the most important B vitamins is B12, methylcobalamin. Avoid your cyanocobalamin, it's synthetic, so go for your methylcobalamin sublingually. That means it's under the tongue. It's a very important constituent of animal protein, which is why vegetarians and vegans and also elders are at risk for a deficiency. We know that it's essential for cognitive function. We use it for depression, fatigue, anxiety, and also for psychosis. It's a cofactor in the methylation process leading to SAMe. And so it's also anxiolytic, and I use it at a dose of 1 to 2 milligrams a day. Now keep in mind, if you've got clients who are using metformin, metformin decreases B12. This is why it's so important to understand the role of pharmaceuticals and their effects on vitamin mineral depletion in the body. Choline, I've mentioned in the form of acetylcholine, a very important neurotransmitter in the brain. Choline is a naturally occurring substance in the cell membranes. It leads to the synthesis of acetylcholine. It's essential for memory and learning. And there are 3 different types of choline that you can use in addition to your daily eggs. One is called CDP choline, also called citicholine, and that breaks down to phosphatidylcholine, which then breaks down into alpha GPC. And you can get each of these as special nutrients. I use these for enhancing cognitive function. They're also called nootropics because they enhance cognitive function. I use them with people who are concerned about performance or are concerned about preventing cognitive decline. And we certainly dose them people at early stage dementia. We know from research that CDP choline has accelerated recovery in head trauma patients. The dose is about 500 milligrams twice a day, and you can go up to 1,500 milligrams. Research suggests it can reduce cravings for cocaine, so it's useful for anyone coming off drug addiction. And it's been combined with lithium, that's the pharmaceutical lithium, to reduce manic symptoms in bipolar. And here you get a feel for how nutrients can be used with people already taking pharmaceuticals, and we'll explore how they can often help to reduce dosage or eliminate them altogether. Water-soluble vitamin C, we're all familiar with the role of citrus in vitamin C in supporting immune function. Quality vitamin C is a complex. It's not just an ascorbic acid, so make sure you get a complex vitamin C. It contains bioflavonoids and rutin, both of which are powerful anti-inflammatories. For example, the white pulp in your fruits is very rich with bioflavonoids and very rich in rutin. And so if you're going to supplement with a vitamin C, make sure it's a complex. And herein we have the principle of making sure that we're not pulling out one active substance, but we're recognizing how nature provides us these nutrients and minerals and cofactors in nature through foods, and how they can be replicated for the use of higher dosing in bioidentical, easily assimilated, complex vitamins. Let's talk a little bit more about fat-soluble vitamins. You can remember them by saying ADEK. A, D, E, and K are your fat-soluble vitamins. We've discussed vitamin D. Let's talk a little bit about A, E, and K. These are a group of compounds called retinoids. They're especially important for the eyes, for immune support, skin, and lungs. And we know that chronic stress, PTSD, lowers immune function, so people will benefit from vitamin A supplementation in the form generally of beta-carotene. We know that people with skin and lung problems also benefit from vitamin A supplementation, generally 25,000 units a day. Though Dr. Jonathan Wright has suggested that high-dose vitamin A to prevent the flu is also an important approach, 40,000 units a day over a period of days if you feel that you're going to be exposed. And we know how chronic stress lowers immune function and can benefit from supporting the immune system. I've talked a little bit about vitamin D. It's used for prevention and treatment of depression and chronic pain. There are vitamin D receptors in the brain, and vitamin D increases serotonin production. Technically, D is called a neurohormone. It helps the body absorb calcium, magnesium, phosphate, iron, and zinc. And cholesterol is a precursor to vitamin D, which is also why these so-called low cholesterol diets can be very dangerous. The dosing, as I mentioned earlier, is at about 5,000 units a day. And I really love the emulsified drops. If you get a vitamin D that is only 1,000 units, then you're popping 5 capsules. So it's much easier to get 1 or 2 drops to take care of what you need in the day. Vitamin E is also a complex comprised of 8 fat-soluble antioxidants called tocopherols and tocotrienols. We know that higher levels of vitamin E are associated with a lower risk of cognitive decline and Alzheimer's disease. General ballpark dosage is 400 units, and it should be a vitamin E that's a mix that contains all 8 tocopherols and tocotrienols. Vitamin K we're hearing more about vitamin K now. It hasn't been as much in our awareness, but we know how essential it is for immune health and the health of our bones and the health of our heart. There are 2 types of vitamin K, K1 and K2. Make sure you're getting the comprehensive range of vitamin K. And I've given you some dosing recommendations here. And with all dosing, it's going to be tailored to the individual, tailored to the person that you're working with, and if you're working with a nutritional therapist, and also making sure you're getting the highest quality complement of vitamins. Vitamin K is also very important in mature women's diet daily. It's very important for bone health, and so every woman who's perimenopausal, but I think every man too in andropause should be on vitamin K. Let's talk about minerals. Dr. David Watts refers to them as the spark plugs in our body because they synergize so much enzymatic action. So consider 2 types of minerals. One's called the macro mineral and the other are the trace minerals. The macro minerals include calcium, phosphorus, magnesium, which we hear so much about for mental health and the treatment of anxiety, sodium, potassium, chloride, and sulfur. We need these minerals in larger amounts. And then the trace minerals are the smaller amounts. That's iron, manganese, copper, iodine, zinc, cobalt, fluoride, and selenium. So let's walk through some of these minerals and see how they're used for mental well-being. Chromium. Chromium is used for depression and mood regulation. It's also used as the premier glucose regulation mineral. It's associated with decreasing blood glucose, and it's effective in decreasing carbohydrate cravings and binge eating. Dose chromium picolinate at about 500 micrograms up to 1,000 micrograms a day. Calcium. Overuse of calcium can be as problematic as underuse of calcium. For example, we know that The overuse of calcium supplements by menopausal or postmenopausal women can contribute to fatigue, exhaustion, headaches, depression, anxiety, and insomnia. An overconsumption can inhibit zinc, phosphorus, and copper absorption. And be careful when you're taking calcium supplements, because many women will take them to stave off or to treat osteoporosis. But Dr. Watts suggests that there are two types of osteoporosis. One where there's a deficiency of calcium and calcium supplementation is beneficial, but one where there's an excess of calcium but it's not being deposited into the bones itself. And so this is really an important theme for our work, that we don't want to take an allopathic or a symptom treatment approach where we're going to take a nutrient or a mineral or any substance and try to apply it to a symptom without taking the needs of the whole person into consideration. We'll see this too when we look at magnesium. Too much magnesium can make you depressed, just as too little magnesium can contribute to depression. And so it's very important that we understand the minerals in particular and how they're going to interact with the body and with the mind. This is why one of the tests I always do with my clients is called a tissue mineral analysis. This gives me a hair analysis of the excretion of these minerals in the hair so that I have insight into the ratios of minerals that are circulating in the body. One of the things that I recommend for calcium absorption is this recipe for calcium-rich soup. And I'll let you read this recipe and make it and enjoy it. It really maximizes the absorption of calcium in the body. The next mineral I cannot say enough good things about is lithium. This is perhaps our first mineral of choice for any kind of mood disorders and for cognitive enhancement and prevention of cognitive decline. We know it lengthens the circadian rhythm, it's neuroprotective, it's anti-inflammatory, it increases hippocampal volume and increases brain-derived neurotrophic factor. And certainly I use it with people with bipolar disorder diagnosis, and you can use the mineral lithium at about 20 to 50 milligrams, particularly when you're asking people to reduce some of their bipolar medication. We can use lithium also in recovery from alcohol addiction, and I like to access what's called lithium orotate. It's known to cross the blood-brain barrier. Contraindication is not to take lithium during pregnancy or lactation. I mentioned in a previous module the idea of soaking in lithium mineral springs as well. So however you get your lithium, it should be really part of everyone's protocol if there's any kind of mood lability or mood disorder, but also for prevention of cognitive decline. Magnesium, we hear so much about magnesium. It's an anxiolytic, it's an anti-stress mineral, it supports healthy cognition and a healthy mood, and deficiency is very common. It improves serotonin synthesis, reduces inflammation and oxidative stress. It does not generally cross the blood-brain barrier, however. The most absorbable forms of magnesium are glycinate and L-threonate. I love L-threonate because it was developed to cross the blood-brain barrier. And research suggests it improves overall cognitive function and can act as an antidepressant and dampen traumatic memories. It increases the levels of magnesium within the brain. It maintains the quantity of synaptic connections between brain cells and has been found to improve both short and long-term memory. As you know, if you take magnesium, it's a laxative. It's a very effective laxative. Magnesium threonate does not seem to have the laxative effect that, let's say, other forms of magnesium have. The traditional way of dosing magnesium is to take magnesium to bowel tolerance until you get loose stools, and then to back off of that. And so you may consider a combination of, let's say, magnesium glycinate or even magnesium carbonate along with the magnesium threonate. Magnesium is also best taken in the evening. You can spread it out throughout the day, but magnesium is so relaxing that I recommend it to my clients who are anxious or who have trouble sleeping to take their dose at night before they go to sleep. Potassium, we all know the rich potassium in our bananas. A deficiency of potassium is very common in bulimia and anorexia. Potassium orotate or citrate is perhaps the best easily absorbed. Selenium, an often forgotten mineral, very important for immune function. We find selenium naturally in mushrooms, for example. We know selenium elevates mood, it reduces inflammation, it's very supportive for immunity. I like aqueous selenium. It's a very easy way to get a few drops of selenium. Contraindications, you don't want to take super high doses. Remember the principle, low doses of lots of little contributions to your mental health. And of course, zinc. We know zinc is an antidepressant. It improves cognitive function in elders. And zinc is also very high in mushrooms and oysters. And supplement zinc also in bulimia and purging and in anorexia. Copper is an interesting mineral because too much or too little can contribute to depression. It regulates cellular energy production. It regulates neurotransmission. We find that in populations where copper is very high in the drinking water, in well water, that can contribute to depression. And so this is something also that a tissue mineral analysis will tell you about copper levels. On the other hand, antacid use interferes with the absorption of copper as well. So copper is a very important mineral to balance in the body. Iodine, food sources include seafood, seaweed, and iodized salt. Supplementation of iodine is not only good for immune function, but it can benefit fatigue, ADHD, and autism spectrum. Iron deficiency increases the risk of mood disorders, autism spectrum, ADHD. Iron deficiency can contribute to fatigue and anemia, poor cognitive function, and developmental disorders. And when you're supplementing with iron, and I really like not using an iron supplement as much as natural food sources of iron to supplement, always supplement with vitamin C. There's a great product called Floridix, which enhances iron absorption. It's a liquid drink. Let's take a moment to consider antioxidants. We've talked a lot about oxidative stress and how we're rusting as we're aging and how rusting is a sign of oxidative stress. And this is why antioxidants are so important for our physical and mental health. Antioxidants are our body's system of protection. They neutralize these free radicals that cause the breakdown of cells. Excess oxidation leads to too many free radicals, and our natural antioxidants from foods, for example, can't keep up with that rusting process. And again, think about your car and keeping on top of the little rust patches that happen. If you ignore them, they just grow and grow on their own. And so keeping up on them with replenishing plenty of antioxidants to fight the free radicals that come out of chronic stress exposures or lack of exposure to the antioxidants is an important approach. And that's why I've emphasized so much the approach to culinary antioxidants. But we also want to have supplemental antioxidants, particularly in response to exposure or aging or signs of oxidative stress that co-occur with and contribute to mental illness. These, for example, might be what are called N-acetylcysteine, NAC for short. It boosts the production of glutathione, which is our most important antioxidant in the body. Alpha-lipoic acid is another one. Coenzyme Q10 is a special nutrient. You're probably familiar with that because many people on statins take it because statins reduce that in the body. And then milk thistle is a botanical antioxidant. So think about the role of antioxidants in your life. Probiotics are called psychobiotics because they support our psyche. And here I've given you some references to some research that is coming out looking at the benefits of probiotics on mental health. Essential fatty acids are essential for our physical and mental health, and this is another place to start and prioritize. DHA, along with EPA, is a constituent of fish oil. We know that DHA, which it makes up a great deal of our own brain fat, increases communication between our synapses, increases dendritic spikes on our postsynaptic neurons. Higher blood levels of fish oil lead to higher brain volume. And there's some wonderful research going on looking at the use of fish oil supplementation in depression in youth. And there's some wonderful work going on by the military looking at high dose fish oil supplementation through either feeding tubes or through IV administration, up to 20 plus grams in cases of acute or chronic traumatic brain injury. The military is doing tremendous work on the use of fish oils for both prevention of PTSD as well as treatment of PTSD and traumatic brain injury. An oft forgotten type of fat is called gamma-linoleic acid, GLA. So I ask you to look at borage oil, primrose oil, blackcurrant seed, hemp seed, and always get at least 1,000 to maybe 1,500 milligrams of a GLA oil. Now, they each have different functions. For example, borage oil is wonderful for joint pain. It's good for skin problems where you've got depression, anxiety, acne, psoriasis, eczema. Evening primrose is ideal for perimenopause, andropause. Blackcurrant seed is very helpful. It's known to decrease uterine spasms, so it's very helpful in PMS or in menstruating women. Hemp oil is a wonderful additive to your daily dose of olive oil salad dressing, and I gave you a recipe for that in an earlier module, my brain booster salad dressing. And so consider your GLA supplementation, and you can get most of these oils in liquid and add a tablespoon to your smoothie. Now, when you're dosing your fish oils, think about anywhere between 2,000 to 3,000 milligrams. As I say, up to, you'd want to do 20 grams, 20,000 milligrams under your clinician's advice. But generally, most people will do well with 3,000 or 4,000 milligrams a day. And you'll adjust that downward for children and adolescents. Another type of fat that we can supplement are called medium chain fatty acids. I think it's easiest to get these fatty acids, which we use for cognition, mood, in the form of coconut oil, maybe palm oil. There's some in raw butter, and you can add it to your coffee. You can add a little butter and coconut oil to your morning coffee for energy and sustenance, for brain support. And there's significant research on medium chain fatty acids for cognitive repair. Let's talk about amino acids. This should be part of your core protocol approach. I want to walk you through a little bit about what amino acids are and how they relate to different neurotransmitters and therefore different mood. Amino acids are precursors to neurotransmitters. The production of neurotransmitters in our body is affected by our amino acid intake. Poor diet, low protein, decreases neurotransmitters. Poor fats decrease the neuronal communication required for communication at the synapse. Think about fats as the lube, as the lubricant for the communication where the neurotransmitters communicate. Amino acid therapies are our core approach to alternatives to psychotropic medication. It's part of the puzzle. It's not the complete puzzle, but we use them as a core approach to begin to decrease or to even eliminate psychotropics. I mentioned earlier that I like the use of what's called free amino acids. It's a broad spectrum of amino acids, and then we can dose up, for example, 5-HTP or tryptophan to add more serotonin, for example. Now, one of the contraindications for amino acid use, and there aren't many, is that people with tardive dyskinesia should not take phenylalanine supplements. So keep that in mind. So what are the 7 nutrients essential for neurotransmitter balance? And then we're going to take a look at specific amino acids. Free amino acids, B complex, we've mentioned B6 and B12 in particular, but a B complex that's rich in B6 and B12 are going to be very important. Magnesium, the mineral, theanine, the amino acid that's part of green tea but is also available in supplements, curcumin with black pepper, tyrosine, which is a constituent of the herb rhodiola or also available as a nutrient, and then eggs, and more eggs for acetylcholine function. This is a chart that I will share with you throughout our modules. I've created this chart to show you the neurotransmitters along the left-hand side, the amino acids in the next column that support those neurotransmitters, the botanicals that support those neurotransmitters, the foods, and then the entheogens. And so if we look at this chart, just the first few, let's look at GABA. Glutamine is the amino acid that supports GABA. Taurine supports GABA. This is why we use taurine. Not only does taurine increase brain neurons, but taurine is a very good support for high blood pressure, for example. Milk-derived neuropeptides, a synthesized called lactium, available in a product called D-stress, targets the GABA receptors, lithium orotate, and phenibut, which is a form of GABA that crosses the blood-brain barrier. Let's look to the next one, serotonin, tryptophan, 5-HTP, the B vitamins, especially B12 and 6, niacinamide, folic acid, all support serotonin. Dopamine, tyrosine. This is why we often will supplement with tyrosine for someone who's coming off of coffee, for example. Coffee increases dopamine, but we might give tyrosine in the afternoon and not drink coffee in the afternoon. So people still feel that boost. Or the use of rhodiola, which is rich in tyrosine. So you begin to see how we start substituting certain foods or nutrients, particularly amino acids and vitamins that balance out the needs of our brain. Likewise, someone with too much dopamine is going to have a bad reaction, for example, to tyrosine. So this is why it's important to understand our client and what their needs are. Theanine is an amino acid that's unique in green tea. You can also get theanine in supplemental form. It crosses the blood-brain barrier where it's an anxiolytic, and so this is why green tea is both energizing and relaxing at the same time. Let's talk about a few special nutrients. Sometimes nutrients are vitamin-like or they're fat-like, but they fall into a special category. Coenzyme Q10 is one of those. If you have any clients with fibromyalgia, coenzyme Q10 is very important for use with them. It about 100, perhaps 200 milligrams a day, divided into 2 doses. You can even go higher. It's very important for heart function. It really supports mitochondrial function in the body. There are 2 forms, ubiquinol and ubiquinone, and the research is equivocal. They both seem to be effective. Sometimes you'll find one report suggesting one is more important or beneficial than another. We use it for treatment of bipolar, depression, fatigue, and schizophrenia. Now, some contraindications: it can reduce the body's response to an anticoagulant. It can decrease insulin requirements. So if people are already taking a hypoglycemic, I would explore that. But generally, most people benefit from a core of 200 milligrams a day. Garum aromoricum, also called by the brand name Stabilium, is a fish bioactive peptide used for health. There are a number of bioactive peptides that have been extracted from fish that are used for mental and physical health. And this is coming out of a blue ling out of the peninsula of France. And you can purchase this nutrient, and it's rich in amino acids and in peptides and fatty acids and vitamin E. It's been shown by research to reduce stress and anxiety, and it's a good alternative to Lactium where there's casein sensitivity. And this leads us to Lactium. This is one of my favorite substances, also developed in France. It's the generic name of bioactive milk-derived peptides, and these act on the GABA receptors also. There's been a fair amount of research showing that they reduce stress, reduce cortisol levels, and they improve sleep. I dose these at anywhere from 150 to 450 milligrams. With clients, they are very beneficial for anxiety during the day at 150, 300 milligrams, but for sleep, up to 450 milligrams, which is generally a few capsules. Sometimes you'll find Lactium as part of a complement of other compounds, or sometimes you'll find it alone as its standalone compound. We've talked a little bit about melatonin as a support for insomnia because it helps regulate circadian rhythm. And the use of tryptophan or 5-HTP can eliminate the use of melatonin. And the contraindication is that the alpha and beta blocking drugs used for hypertension can disrupt sleep by melatonin release. So explore that with the prescriber about, particularly if your client has high blood pressure. Phosphatidylserine, I think, is an essential nutrient, particularly for people with chronic stress, with PTSD, complex trauma. It's a phospholipid, which is a key component of a cell membrane. It's essential for the transfer of biochemical messages into cells in the brain and into the CNS. It regulates cortisol level via the HPA axis. So anybody that's got disrupted HPA axis is going to benefit from phosphatidylserine. Generally a dose of 500 to 1,000 milligrams. Well, no, let me alter that. Phosphatidylserine, generally I would use that within another compound. I would do that at about 100 to 200 milligrams a day. It increases acetylcholine in the brain. It supports memory, and it's found in egg yolks and liver. And so this is one of your essential special nutrients for treatment of anything involving cognitive function, trauma, traumatic brain injury. Phenibut is a very special nutrient that's a derivative of GABA. We see a lot of people taking the amino acid GABA, which does not readily cross the blood-brain barrier, so that Phenibut was developed to actually do so. And it acts on both the GABA and the dopamine receptors. And it's an alternative for the benzodiazepines. So this is what I would look to if you're looking to help someone decrease benzodiazepine use. And what I would do is use some Phenibut at a small dose as people begin reducing their benzodiazepine by milligram. And when we look at pharmaceutical decrease and elimination, I'll walk you through the steps for how to do that. So in the meantime, you can think about Phenibut. It's useful for short-term treatment of anxiety, drug, and alcohol withdrawal. It can be, the individual can be susceptible to developing dependence on it, certainly not like the benzodiazepines, but nevertheless, it should be used for short term. Let's look at our favorite fruit, the pineapple, rich in the core in bromelain. And bromelain is a very important proteolytic enzyme. It inhibits inflammatory enzymes in the body. The core of the proteolytic enzyme is found in the core. It was not found in the ripe pineapple, alas. We can enjoy that as a fruit. But the marvelous nature of both the pineapple enzyme bromelain and the papaya enzyme papain is that they have been concentrated into capsule or pill form. And these are very useful in breaking down fibrin, in reducing swelling in the body. I use them with my clients who have chronic pain and chronic depression, always part of fibromyalgia treatment, and they have to be taken on an empty stomach in order for them to be effective. And I've got a number of very excellent products that combine proteolytic enzymes and that are essential for the treatment of pain and depression. We hear a lot about CMHIMP. It's synthesized from the amino acid methionine. It plays an important role in methylation and the synthesis of serotonin and dopamine. And there's a whole body of science of integrative mental health, certainly the work of Dr. Walsh, looking at the role of methylation as it contributes to mental health, either over-methylation or under-methylation. And this also gives us insight into why some people react very well to CMHIMP and why some people have very strong negative reactions to CMHIMP. It's beyond the scope of what we will explore in this module, but if you're interested in the whole area of methylation and mental health, I refer you to the work of Dr. Walsh. CMHIMP is critical for glutathione synthesis. It's our major antioxidant in the liver. And it's postulated that its antidepressant effect is due to its influence on neurotransmitter metabolism. CMHIMP is a very popular substance, but as I say, not everyone benefits from it. It's often used for depression, for osteoarthritis, and also liver disease, particularly coming out of alcohol abuse. UMP is the basic building block of RNA and DNA, both of which I suggest are very helpful for treatment of depression, of cognitive decline. It's part of a wonderful product called Cognitex, and Cognitex with pregnenolone. It supports CDP choline and acetylcholine levels in the brain. It is really synergized by combining with DHA, so you begin to see how a number of these substances work together, synergize each other, and give you a complete protocol. And that leads me to RNA, DNA supplements. Much of it's synthesized out of a yeast product, and you can use it if you're recovering from illness or surgery. It enhances cognitive function, supports immune function, and there are different supplements in RNA, DNA, but I can't say enough about the use of RNA, DNA, particularly in elders, or to really sustain focus and energy during particularly stressful times. Let's now take a look at glandulars. Glandulars are found in both traditional foods, glands, and organs, such as liver, pate, or lungs, stomach, intestine. People's world over still eat these glandular foods. But for many of our purposes in modern life, we want to have what are called the lyophilized or dehydrated glandulars. Glandulars are known to target and rebuild tissue. Many glandulars have small amounts of hormones in them also. And we still see the use of glandulars in the use of thyroid glandular, porcine glandular, for example, or pancreatic glandular as well to decrease mucus, all in allopathic medicine. So there's a long history of the use of glandulars for health. Let's look at them. On the right-hand column, you see how people continue to eat foods that are glands: tripe, the intestines, lung, sweetbreads, heart, liver, tongue, testicles, kidneys, and blood are just a few examples of animal foods that nourish people. To the left-hand column, I've listed these resources that are now found in dehydrated form, which we use to rebuild tissue and support brain function and bodily function in recovery from mental and physical illness. If we look at this glandular supplementation chart, on the left-hand column, I've given you the name of the gland, and then in the middle column is the benefit, why you would take that gland. And the right-hand column is the dose range of that gland. So let's look at adrenal. Almost everyone in our stressful society is going to benefit from adrenal support. Helps the body respond to stress. It decreases inflammatory process. It's certainly helpful in addressing fatigue, sugar metabolism, and weight loss. Indeed, it's a wonderful gland to supplement when someone's using too many stimulants in their life to give them the energy they feel they need. Give them a natural adrenal glandular instead. Adrenal cortex is a particular part of the gland that helps respond to the chronic stress as opposed to the acute. Brain glandular, we use this in cognitive decline and depression. It supports HPA axis. If we go to the next chart, hypothalamus. This is a very important glandular because it targets the hypothalamus, very important in supporting the stress response. We know that there can be brain shrinkage under chronic stress. Hypothalamus is a very important gland, and what I've observed in clinical practice is that hypothalamus use can sometimes stimulate dreaming. And so it's very important, particularly if someone has nightmares or traumatic dreams, to adjust dosage so that it doesn't overstimulate those dreams. Very useful for the treatment of traumatic brain injury, should be part of that protocol. Liver is so important for someone with chemical exposure or any kind of drug and alcohol addiction to help rebuild and support liver function. Pancreas, very important to support blood glucose. It supports fat digestion. And indeed, there's a whole area of prevention of cancer which uses the pancreatic glandulars. Pituitary glandular, very expensive, but nevertheless and hard to collect glandular because it's so small, supports hypothalamic pituitary adrenal axis along with depression. This is your chronic stress clients who are also chronically ill. And then, of course, thymus glandular, so important for immune function, thyroid glandular, specifically where there's the low thyroid function associated with depression. So what are some of our steps for making and creating nutritional protocols for our clients? Education. Let's educate our client about the role of nutritional supplementation. I really believe that if our clients understand why we recommend certain foods and certain nutrients, then they will understand, engage, and adhere to a program. Prioritize the core nutrients for the clients. What will come from supplements? What will come from foods? For example, are they going to make a fresh sauerkraut? Are they going to buy a fresh sauerkraut? Or do they prefer popping a capsule or putting some powdered in their smoothie? Review the assessment and the findings and match specific modes of their ingestion. Is it smoothies, capsules? Is it intravenous? Apply the drug-nutrient interaction database as you create the protocol design. Consider a consultation with the clinician, and we'll explore this more when we're looking at consultation with a prescriber, when our client wants to reduce or eliminate pharmaceutical use. Develop both a core protocol and an adjunct protocol. Begin one step, one nutrient at a time, and build towards what is optimal. And identify obstacles and challenges to adherence. I want to share right now about the Myers cocktail. This is a well-known intravenous cocktail of magnesium, calcium, vitamin B6 and 12 and C. It's used for migraines, fatigue, chronic fatigue syndrome, fibromyalgia, acute muscle spasm. I've sent my clients who are in recovery from alcohol and drug abuse. I suggest the Myers cocktail. Certainly many people will benefit from it, but it's often a way to jumpstart a response. IV nutrients will jumpstart any kind of response, but also where you're having trouble with compliance, where someone is going to have trouble carrying out some of the protocols in their home. This is a good way to begin, and it's IV, and it's slow. It's a slow push so that people relax in the prescriber's office. Some nurses or clinicians, technicians will even go to the client's home. And if you are a tired clinician, Myers cocktail will give you a real boost. It really makes you feel great. I'd like to walk you through now some protocol examples, and I want you to have some time to study the slides. These protocols are also taken out of my writing and book. I've adjusted them a little bit, and I want you to get a feel for how we put together both the core nutrients along with adjunctive, and how sometimes we use the same nutrients for everyone as a core, and then we change it according to what their particular needs are. Here you see a protocol for depression and how we adjust it for pain. We often see pain and depression in chronic pain treatment, for example, often go together bidirectionally. People in chronic depression often have chronic inflammatory process and chronic pain, and people who have chronic pain are depressed because of the effects on their life. So we want to integrate 5-HTP for depression, DL-phenylalanine for chronic pain, methionine, SAMe if they're a candidate for SAMe. Certainly dose up your fish oils and divide them throughout the day. capsaicin, and this is where for pain I might add capsaicin as a topical treatment. I also do this with people with fibromyalgia. You can buy this over the counter, or where you've got localized chronic neurological pain, I will go get a prescription with a prescriber and work with a compounding pharmacist to make a cream of a topical NSAID, for example, ketprofen, to which capsaicin and ketamine is added. Don't forget to look to your compounding pharmacist. They are a wealth of information. They know a lot about treatment that's often natural, that's using nutrients both internally as well as topically. And there are some wonderful topical creams. And the benefit of the topical NSAID is it's not absorbed quite as systemically with its side effects as it is if it's taken orally. I would rather have an oral botanical NSAID along with phenylalanine and then use a topical compound such as this. And then a little later on, when we discuss somatic therapies and energy medicine, I'll talk about cranial electrical stimulation. But here you see a combination of amino acids, fish oil, a botanical, capsaicin, and here's where we get into a prescription that has fewer side effects, and then some energy medicine. This would be a good start for chronic pain treatment. I talked a little earlier about phenylalanine. Use it for chronic or acute pain and depression. Use it at 1 capsule every 2 hours, 250 milligrams to 500 milligrams. But for chronic pain or depression, use 2 capsules 3 times a day. And here with depression, complex vitamins and minerals with L-methylfolate, omega-3 fish oil, gamma-linoleic acid, free amino acids. And you see how I've put together this combination of minerals, vitamins, glandulars, amino acids, special nutrients. Here you see a chart with anxiety. Again, the complex vitamins and minerals, your vitamin D levels. But here, as we go on down from these core nutrients and core vitamins, you'll see magnesium threonate, alpha GP choline. Continuing to anxiety part 3, lactium, which targets the GABA receptor. And something I haven't talked much about, orthophosphoric acid, is used for 30 drops every day, just for 30 days in the first month of anxiety, panic, or depression. Lithium orotate, taurine, where there's high blood pressure or gallbladder problems, and glycine strips. So this would be a protocol for panic, but I would add glycine in if there was panic as well. Phenibut. Now this, I can appreciate, this is a lot of nutrients, a lot of support. So begin step by step. Part 4 takes you to glandulars, stabilium, and particularly in menopausal women, consider oral micronized progesterone as an anxiolytic at bed. And then of course phosphatidylserine, where there's post-traumatic stress. So if you look at this table, you're not going to take all of these nutrients. You're going to have a core, and then you're going to explore what may particularly target the type of anxiety or the special stage of life that is also contributing to the anxiety. If we look next to sleep-wake disorders, you see we've got our core nutrients. We may have changed some of the dosing a little bit. If we go to part 2, you see I've added melatonin in here at 0.5 to 1 milligram a night. So you see a lot of the treatment for anxiety is very similar to sleep-wake, but the dosing may differ, or the order in which you try something may differ. Here is a protocol for psychosis, schizophrenia. Again, your core protocol that's going to benefit everyone. And then if you go to part 2, the protocol for psychosis and schizophrenia, glucose tolerance factor. We know that glucose management in psychosis is often an issue. It's exacerbated by the psychotropic medication for psychosis as well. Glycine at much higher doses than, let's say, we'd use it for panic, has been found to be effective for psychotic symptoms. Glutamine as well targets the GABA receptors, so enhances relaxation. N-acetylcysteine, pregnenolone has been found through research. It's called the master hormone to help in psychotic disorders. And finally, a CBD-rich form of cannabis, perhaps in the form of drops or an extract, has been shown to be helpful with managing symptoms. I think a low THC, I think the THC can be problematic in cannabis and psychotic disorder, but the CBD-rich cannabis can be very helpful in management. And I think, frankly, that's why a lot of people with the psychotic disorders gravitate towards cannabis use because they benefit from the CBD, but they often get the side effects from the THC. And then finally, proteolytic enzymes. We know that there's a high level of inflammatory process and oxidative stress in the psychotic disorders. And don't forget the high rate of gluten sensitivity in the psychotic disorders. Obsessive compulsive disorder, in this first chart, you see our basic core principles. If you go to part 2, N-acetylcysteine at the bottom, glycine also in OCD, and you'll see at the end that I've added inositol, one of our really core nutrient resources. The inositol has been shown to be effective when it's dosed at least 10 grams. However, one of the effects of inositol can be a lot of gas, and so that's why I say here in this chart, start at 1,000, begin 1,000 to 3,000 milligrams, see how well it's tolerated, and then you can move up from there. I promised you Dr. Hoffer's protocol for alcohol. He suggests, this is alcohol addiction and recovery, vitamin C to saturation, that takes from 10,000 to 20,000 milligrams a day. 2,000 to 3,000 milligrams of glutamine, and remember glutamine is an amino acid that targets the GABA receptors. It decreases the physiological craving for alcohol. Now, it's naturally produced in the liver and the kidneys, and so it stands to reason there are going to be lower levels of glutamine in where the liver has been damaged. And also lecithin, a very good source of phosphatidylcholine, very important for fatty liver disease associated with alcohol addiction. He suggests 2 to 4 tablespoons of lecithin a day, and those of you that remember Adele Davis, that was one of her go-to foods, lecithin, very good for brain function. Just get it and add it to your smoothie. Indeed, speaking of adherence, it's very difficult for people coming off alcohol and drug addiction to pop a lot of pills, and so I really like the combination of going back to culinary medicine, using the bone broths, the calcium broths, just very easily digested, tasty, fatty foods for alcohol recovery. And at the same time, of course, don't forget your bitter greens so the liver can handle those bone broths and fats. And at the same time, add your fish oil, your lecithin, your powdered nutrients into a daily smoothie. And this is where people benefit from a caregiver, a helper, family member to help them get in the process again of self-care. And there's a quality about it as well that replaces the ritual. So much about alcohol, drug, any kind of a abuse of substance is located in the ritual. So replace one ritual with another. replace the ritual of self-harm with the ritual of self-care. And I think the use of broths and crock pot soups and smoothies are an excellent way to go. And this works also very well in public health settings as well. It need not only be a home setting. Dr. Hoffer also suggested chromium at least 200 to 400 micrograms a day, and I would suggest you could go even higher than that. And then also mix your 400 milligrams of magnesium and then the antioxidants, the beta-carotene and the tocopherols, the vitamin E tocopherols, because that's going to help restore liver function. Let's take a moment to explore cognitive impairment. We recall that this is defined as having trouble remembering, learning new things, concentrating, making decisions. We know from research now that cognitive impairment by and large begins when it's chronic, as for example in Alzheimer's, begins 20 or even 30 years before symptoms manifest. I'm going to talk about not only cognitive impairment in terms of Alzheimer's, but also in vascular dementia, but also this will apply for recovery from traumatic brain injury as well. And we know that trans fats are a major risk factor to cause cognitive decline in terms of food exposure. We know chronic stress, PTSD, and depression are risk factors in the development of cognitive impairment. We also know, thanks to the work of Dr. Bredesen, that cognitive impairment can be reversed, particularly if it's caught at the earlier to moderate stages. And I think this is what's so exciting right now. There's a lot of misdiagnoses of mood and cognition, mood lability and cognitive decline. There's often a missing piece where people aren't understanding what's going on with the brain. And so doing a thorough assessment, even pulling in a neuropsychologist is going to be helpful. There's no such thing really as saying, oh, I'm having a senior moment. You may be having a senior moment, but it's not necessarily a normal moment to have. And so I think we're understanding now that in healthy brains, we don't get this cognitive decline, and that senior moments can lead to more significant cognitive decline. There's also an understanding now, thanks to the work of Dr. Bredesen, that there are several types of Alzheimer's, including evidence for non-inflammatory low zinc levels of Alzheimer's, and a type that's related to what's really called diabetes type 3. So we know that what occurs in the heart occurs in the brain. And so when we're looking at Alzheimer's, we're looking at reducing high levels of glucose in the body. We're reducing inflammatory process. This is why we're going to use our turmeric, our hops, our rosemary to suppress these inflammatory cytokines. We want to increase blood and oxygen flow into the brain. This is where we're going to use products like ginkgo and vinpocetine, vitamin E, and a wonderful treatment, hyperbaric oxygen therapy, can become part of our protocol. It's being used for stroke recovery, traumatic brain injury recovery, and cognitive enhancement. Dr. Harch in Louisiana has been conducting research. It's been used off-label for many years for this purpose, but he's conducting some very good research in this area. We know that insulin resistance, where you want to enhance adrenal function, enhance liver function, and reduce glucose intake in the body, is associated with the development of cognitive decline. We know loss of brain volume. This is where we use our glutamine, where we use our brain glandulars, our cranial electrical stimulation, where we add fats into the diet. Impaired neurotransmitter function. This is where we again support with the free amino acids. And then of course the hormones are all important. testing for levels of DHEA, testosterone. When I have a male client come in at 40, he's depressed, he's not sleeping well, we test the testosterone. Generally, they're low levels. We call it andropause. Both men and women benefit from testosterone supplementation. All natural, not injected, not the patch, but bioidentical. And then, of course, we know toxic accumulations of heavy metals in the brain, which we'll explore the elimination of during the detox module. So amongst our food and nutrient protocol, coffee, black tea with medium chain fatty acids, raw butter is a wonderful mood and cognitive function booster. Foods, that's your eggs and your liver rich in phosphatidyl serine, or you can supplement at 100, 200 milligrams a day. The amino acids with 5-HTP start at 25 milligrams, but you might go up to 200 milligrams. Use adrenal, brain, and hypothalamus, even pituitary glandulars with cognitive decline. And where you've got depression as well, I add acetyl L-carnitine, GPC choline, ginkgo, and huperzine. Now, just remember that ginkgo can, because it increases blood flow in the brain, I've had some patients complain of headaches when using ginkgo. And this is why it's very important to start people off on individual products. There are some wonderful compounds out there that combine everything, but you can get a reaction to just one constituent of a compound, and then you don't know what's doing it. So go step by step, and then when you've cleared all of these and they're having a good effect, then you can buy a product that combines them all together. I want to take a moment to look at some other items that I would include in a cognitive protocol to give you a sense of all the constituents. Huperzine is an acetylcholinesterase inhibitor, so the more acetylcholine we have, the more memory, the more new learning. This is from a botanical called Chinese club moss. Bacopa, a very well-known Ayurvedic plant, also called Brahmi, has been shown to enhance cognitive function. We know that the amino acid alcar, acetyl L-carnitine, found in high quantities in red meat, crosses the blood-brain barrier, it enhances acetylcholine, it boosts brain metabolism, it enhances cellular energy, it lowers insulin resistance, so it should be part of everyone's cognitive enhancement program at about 250 to 500 milligrams. And because it's stimulating, I would do it early in the day, not later in the day. It's potentiated, you'll recall I talked about choline supplementation earlier. It's potentiated by GPC choline and R-lipoic acid, a very potent antioxidant. So you can combine huperzine, R-lipoic acid, and alcar. You see how we're putting together all of our vitamins, minerals, special nutrients, glandulars, amino acids, and botanicals to really create an integrative protocol. And let's not forget lithium orotate on cognitive function on the next slide, 20 to 40 milligrams a day, RNA, DNA, and I mentioned earlier phosphatidyl serine. And here is the list of glandulars for cognitive function: brain, hypothalamus, pituitary, adrenal, liver, especially where there's mood and anger, heart, and thyroid. Remember, the healthier our heart is, the healthier our brain is, and vice versa. Now let's take a moment to see how this might apply for the very special protocol for people with moderate to advanced stage dementia, which leads to sundowning or late day confusion. This is where later in the afternoon, as the sun starts to drop, people with dementia can get very agitated. It's theorized that there's a decreased production of melatonin, there's a degeneration of the suprachiasmatic nucleus, which is our circadian pacemaker in the brain. And this is where we integrate light therapy, 2 hours of morning light therapy, melatonin. You recall my cherry chamomile smoothie, also a delicious drink, supports melatonin. I would provide about 500 to 2,000 milligrams of a pituitary hypothalamus glandular. And while we haven't yet explored somatic approaches, I want you to keep in mind the role of cranial sacral massage, hand massage, and the use of aromatherapy, which research suggests is very effective, particularly the plant called Melissa. So we begin to put together for the treatment of cognitive decline and dementia a whole range of approaches. And I've worked with people who are both living in nursing homes as well as at home with care to implement these integrative approaches. And then finally, let's think about hormones a little bit. Sometimes it's the hormones. So think about andropause in men. Low testosterone contributes to depression, irritability, low libido, gain of weight, especially in the belly. Perimenopause is usually associated with low progesterone, increased anxiety, sleep, irritability, sometimes foggy thinking. Menopause, by this time you've got low progesterone, low estrogen, and low testosterone. And then, of course, we've got the hormones for the thyroid hormones. But usually we've got a low thyroid, though sometimes there can be hyperthyroid. And so this is where we want to integrate with specialists in endocrinology and what we'd call functional endocrinology, referral to someone to assess hormones, and that becomes part of the optimized protocol program for our clients. Thank you.